expanding what DMCC does, and we want to educate and promote a higher level of consciousness, basically, in Del Mar. Del Mar's already got a super high level of consciousness, and we want more. And that's why I brought Dr. Bierman here today. He's going to tell a few stories and kind of talk about getting well in a true way, as opposed to symptom relief, and he's going to tell us how to get there. Steve Bierman.
Or can I move?
No, you can move, but that camera, it actually will get you moving. Yeah,
Trying to get the logistics down.
Yeah.
Is my mic turned on? Yes. I better watch what I'm saying. Well, good afternoon, and thank you all for coming out. It's nap time for me, so this is already a bit of a challenge. I'll do my best to keep all of us awake and engaged. If you have questions and you have to get it out, I'll understand that. And you can raise your hand. If you can hold it till the end, probably better, because I got to stay on my thread too. All right, and then I'd like to ask a couple questions so I know who I'm addressing first. How many of you are caregivers in any capacity? Helping a loved one, professional? Yeah, that's great. My wife. This is how it starts. So, fine lady in the audience looks at me and says, you don't look like your picture at all. I go, well, you know, that's my Match.com picture. And she says, yeah, your hair's a lot whiter. And then my wife says she's a caretaker, so we're off to a good start. Let me tell you the setup for this, sort of our flight plan, and what I hope to achieve. And if we don't make it, then we don't make it. This is Mark's agenda as given to me. He said, Steve, first, you've got to cover what's wrong with medicine today, because people are out there having trouble with the system. Then you have to teach everyone what would make it right, what the logical error is, how to fix it, and what the effect will be on doctors. And then finally, you have to leave everyone with some pearls so that they can stay healthy for the rest of their life. And you've got 45 minutes and questions. So that's our flight plan. I'm not sure we can get through all of it, but let's give it a shot. True story. As a neighbor, everyone I talk about except Mark or myself, I'll change the name. But all these stories are true, and most of them involve either someone in this room or someone Mark is familiar with and can attest to. Because some of these things I'm about to tell you won't sound true. There are stories that I myself didn't believe were possible as they were happening. But this one we'll all believe is true. It doesn't involve hypnosis or me or anything fancy. It's a next-door neighbor. He has intermittent atrial fibrillation, a heart arrhythmia. And it's concerning. He goes to his family doc and says, hey, my heart's palpitating. A monitor is placed. They see he has atrial fib. And he's immediately referred to a specialist, a cardiologist. And in the meantime, some blood tests are drawn, just so you know. So the possible contributing physical causes, potassium, thyroid, magnesium, things like that, those are all normal and known to be normal in this story. But he goes to a cardiologist, you know this guy, and he's sitting there in a paper gown in a cold room for 10, 15 minutes, getting angrier and angrier. And the cardiologist holding the electrocardiogram walks in, looks at him, looks at the cardiogram, says, well, you got atrial fibrillation. You need an ablation. He goes, well, I don't know what an ablation is. He goes, well, simple. You know, we put a thing in your heart. That right there would probably stop most people. And then We basically fry the inside of one chamber so it scars down and you can't have this erratic rhythm anymore. And at that point, my neighbor is shocked, more angry than he was. This is going to be an important theme, though. If he hadn't been angry, something bad might have happened. So hold that thought. Walks out and goes, oh man, this is not right. I got to see someone else. Now, is there anyone in this room who feels okay about that? You do? You do? Sorry? But that's not the question. The question is, do you feel okay on your first visit, the first moment you see someone, right? So what I want to do first is I want, because this story actually ticks me off a little bit, you know, I'd like to talk to the guy. But let's see if we can be noble in pondering what goes on here, because this goes on in 1,000 different ways every day in every office throughout the land, right? Here's what this doctor was taught. And mind you, this is a guy who started with a heart full of compassion, let's assume. He then went into his medical training and spent 15 years learning mountains of information, right? And the information focused on the science. And the science had to do with physical things, with atoms and molecules and cells and tissues and electricity, and how those electrical currents pass through the heart. And then he specialized and he learned more and more and more about the electrophysiology of the heart. In other words, this guy was trained into the notion that everything is physical, and if it has a physical cause, what we have to do is find a physical cure, and that's how we fix people, right? That's what's going to make them well. So within his model, he's doing everything that he knows is possible. He's already ruled out a thyroid problem or an electrolyte problem. There's nothing else. Why bother talking to the guy? Really, let's just hack the atrium with some nice scars and stop the fibrillation, get on to the next guy. This is how they're thinking. And you need to know that first and foremost, okay, that our science, and Mark said, you know, I'm a traditionally trained MD with 17 years experience in the emergency department. I know what Western medicine can do. It's phenomenal. It's phenomenal. I don't want to go see an herbalist if I'm in a major automobile accident. But I do want to go see that herbalist at other times, right? Something is wrong with our basic paradigm. And it has to do, though we never talk about it in our medical training, with our causal notions, how we think about cause and effect, how we think about what causes health, or what is health, and what causes illness. And it's a really good thing for you to understand that that's where your doctors are coming from, with these simplistic causal notions. There's a physical cause, physical effect, and a physical cure, right? Well, what if there's something more? What if mind matters? What if psychological factors? You all have an intuition. You'd like to think, oh no, I think there's something more to it. Maybe that guy with atrial fib is, let's pick on Mark for a second, isn't feeling connected. Or that's a fair hit. Or let's say that he's stressed, whatever that means. Right? You have some sort of intuitive sense that there might or almost must be something else going on. But there's no science that this cardiologist is aware of to prove that out. I became, like Mark, frustrated, very frustrated with primary care. Maybe sooner than Mark did, because I was in my third year of family practice residency. And I remember holding this 3-inch thick chart of one of my favorite patients and kind of thumbing through it on the last day of my residency. And I'm looking at a strep throat and looking at this and looking at that, and here pneumonia, and there's some anxiety, and here's some gynecology. And I thought, what am I doing? You know, this is a thick, she came to see me every 2 or 3 months for 3 years. All I did was treat. It was like, I call this like a series of blunt beginnings and endless endings. And had I treated her another 10 years, it would have been an enormous chart. It didn't seem right, which is why I fled into the ER so I could self-justify, right? Because I didn't know how to fix it. But about 10 years into my emergency department experience, I started asking the most important question that you as a caregiver can ask once the diagnosis is made. I want to qualify. You have to do what you've been trained to do and figure out what's going on first, okay? So don't change anything on the upfront. But then there's one question you can ask, and you have to ask it a certain way. It takes a little patience, takes a little training. I'm going to teach you that right now. And it opens up this whole new world of contributory causes to both health and illness. And the question is, why today? And I'll tell you how I got on this, because my neighbor Jim is here and he passes by this tree all the time. One late autumn, I was walking up A Street where I live and turning onto Stratford. And there was one leaf left on the liquid amber tree. One leaf left. And as I was walking by, it let go. And it just drifted down ever so slowly, beautifully. This little copper leaf falling on the asphalt. And I remember thinking, wonder why that happened today. And I went to the ER later that day, just coincidentally. And this is what happened. I picked up the chart. It was a 35-year-old guy, 37-year-old guy, married, and he complained of left testicular pain. And as an ER doc, you're always sort of relieved because that's going to be an easy case one way or another. It's not going to be complicated. So I go in. Nurses had gotten all the labs and things done before I got there, examined the man, and he was fine. He had no real signs of an infection. He had no real sign of any systemic illness. He had a tender epididymis, a little structure above the testis. And so I sent off culture and treated him with anti-inflammatory antibiotic, referred him to a urologist. Boom, done, bug drug, done. It's what we do. But I couldn't resist because I had that leaf experience on the way to work. And so I said to him, hey, you're not going to know the answer to this question. But you could have had this happen a couple days ago or sometime next week. Like I said, you're not going to know. But if you had to guess, why do you think he had that today? That's the most important question you can ask after the diagnosis is made. Because here's what happened. He said what they all say, what we all say. Doc, I have no idea why I have this today. No. I know you have no idea, but if you had to guess. And then the hardest thing to learn to do is just shut up. Shut up and listen, because it's going to come. And it often comes slow, and it did in this case. And this was my first time. Getting his pants up, getting things shoved in. I have patients out there. I got to go, but I'm dying to see what happens here. As he gets his buckled up, he goes, hey, doc, let me ask you a question. You think this is going to interfere with my vasectomy tomorrow? My wife's dying to have me get this. Now, I know there's one skeptic out there saying, that's a good story, but it's a series of one. So let me tell you a couple more. This is really important. Really important, because these stories the next couple I'm going to tell you, you can distill something precious out of this for your own health and healing. It's really important. 17-year-old guy comes in, and he has mouth sores. And that's a strange thing to go to the emergency department for. I don't really get it, but I take a tongue depressor and look back there, and sure enough, way back here, just above the wisdom teeth, there's this cluster of 5 or 6 or 7 mouth sores, aphthous ulcers, canker sores back there. Very painful for him. Referring pain into his ear even. He'd never had this before. You change your diet? No. You under stress? I don't know what that means, neither do you, but I asked it anyway. No. Anything else, any medicines, anything? No. And you've never had this before? No. Okay, so then, I'm doing this for Mark's amusement now. It's embarrassing how I constantly treated these in those days. But anyway, I took silver nitrate sticks and just, you know, an active placebo maybe. Took care of them. And then I said what you're supposed to say, what we're learning here today. You know, you probably could have had these a day or two ago. It's always like casual conversation. Or I imagine maybe you could have had these tomorrow or the next day. You're not going to know the reason for this. But if you had to guess, why do you think you had this today? Again, it's always the same answer. Doc, I have no idea why I have them today. That's why I came to see you. No, I know that. I know. Of course not. But if you had to guess, boom. Now I shut up. Same thing, long pause, rustling around, this and that. Getting ready to go, hey doc, you think this is gonna mess it up when they take my wisdom tooth out tomorrow? Which wisdom tooth? The one right underneath those sores. That's kind of telling, isn't it? If mine matters, right? Now, if you go to we don't really know the whole thing about aphthous ulcers, but if you go to a bench scientist, he's going to say, well, here are the cells, here are the offending agents, here's the treatment. Physical, physical, physical. And yet we're beginning to hear tendential answers to questions that at least suggest there may be some mental contribution to this. But it doesn't fit in our science at all, does it? What's going on, Michael? Friend of mine, Candace, 32 years old. She and her wonderful husband, Phil, decide after some back and forth, it's time, let's have kids. Let's do this. And so they really want to have kids, but they have a problem because she's had fallopian tube infections in the past. She's blocked. They have to get the surgery. They're not wealthy people. Surgery is $30,000. They don't have it. I was well aware of all this. But I didn't put 2 and 2 together because I did not know. She comes into the emergency department. Terrible right lower quadrant pain, rebound, tenderness, white count, da-da-da. She's got appendicitis. A little tiny stone blocks the appendix. The bacteria grow and proliferate. Inflammation, cut it out, you're cured. Physical, 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 ka-chunk, done. No mind in there. Candace, appendicitis. Where'd that come from? You could have had that yesterday or 2 years from now or tomorrow. I know you don't know why this happened. Of course you can't know that. But if you had to guess, what would you guess? She goes, Steve, that's silly. I go, I know. It's silly. But if you had to guess, zip it. They're whisking the gurney down, right? She's heading for the OR. She turns and says, hey, while they're in there, you think you could ask them to open up my fallopian tubes? Our insurance pays for everything that comes through the ER. Oh, okay. We're not at a series of 1 anymore. And that's peculiar. Let me give you one more. I could give you 1,000 more. I could give you 2,000 more. But it is nap time, so I'm going to cut it short and just give you this one. A different neighbor. There's something going on 8th Street. That's why we scrupulously filter our water, right? Has palpitations. And he's seen a really good doc, really good specialist. He's been thoroughly evaluated. He's been checked up one end and down the other. Can't figure it out. Nobody can figure it out. But these palpitations are really concerning. They're really worrying him. So I'm sitting with him. I got to change his name, George. So I'm sitting with him outdoors on 8th Street, just, chatting it up. I go, George. No, I'm glad I changed it because Jim knows there's no George on 8th Street, so I'm safe here. I go, George, you could have had these palpitations a year ago or like 3 years from now. You tell me your it's the same old, right? Why do you think you have them today? Why now? He goes, I have no idea why now, you silly. What do you think I am? I go, no, my bad. I know you don't know. What would you then say? You had to guess. And then what would you then do? Zip it. Which is exactly what I did. And here's what he said. And I love this guy because this came out with such purity. You couldn't ask for a better contributory cause. He goes, well, I don't know. Hey, you don't think I'm trying to get some physical reason to get out of my practice and retire early so my partners don't think I'm a wuss? Think about that. All these various ideas, which if you condense them down, and this is the important thing. This is our first lesson today, okay? If you condense them down, what's the common element? Intention, a wish. Not that they wished it consciously. They didn't. Almost never is it conscious. But guesses come from the unconscious. That's why I'm saying if you had to guess, what you got? Be careful what you wish. It's not innocuous. In fact, it can be dangerous. And I'm going to say this because I said this in a course I was teaching earlier this year, and it changed a person's life. The worst wish you can ever wish is the no matter what wish, because your unconscious is listening. If you say no matter what, it'll reach for and I'll show you why later. It'll reach for the easiest first thing available. Don't say no matter what. Be very specific. If you want to get out of work, say I want to get out of work in a healthy way. Only healthy solutions, period. Be careful what you wish. Every one of these is a wish fulfilled. So remember, we started with a pure physical causal chain. And now we're beginning to introduce the notion that mind matters, that ideas may have some effect. We haven't proven anything. If there are any really rigorous scientists out there, they have every right in the world to challenge me right now, right? I just gave you 4 cases, big deal. Let's go and look at the other side of it. If ideas can make you sick, we have to explore is there any suggestion that ideas can make you well? Because that would be, okay, now you know to watch your wishes. We could end it there. But wouldn't it be better if there was something proactively if there were ideas that could make you well. Some of you are my patients. You already know that can happen, right? But let's explore it. It turns out at UCSD, I don't know if you guys know this series of studies, but it's brilliant and it's worth looking up online. UCSD social scientists, they wanted to explore the idea of what happens as people approach positive life events. What happens to their health? And the first community of people that they looked at were Chinese people, and they said, you know what? Chinese New Year's is a positive life event. We know exactly how many people are scheduled to die, actuarially, month by month by month in this community. We got the data. Let's see what happens as we approach Chinese New Year. And they did this once and didn't believe it, and did it again and again. And what happens is, as these people approach Chinese New Year, this shouldn't surprise you. Think to yourself, as I'm telling this series of studies, how many times there's been something you had to get to, and you started to feel a tickle in your throat, and you said to yourself, no, I can't get sick. And you didn't get sick, and neither did I, because I felt that tickle last night. I wanted to be fresh and perky for you guys. Death rate goes down. In the 2 weeks leading up to and the 2 weeks after Chinese New Year's, there's an enormous dip in the death rate. Yeah, those Chinese, they're smart. But it's not just them. Because then they said, well, let's look at the Jewish community. Let's pick a positive life event. And they picked Passover, because they know that sisters all over the world are getting the Seder dinner together for the family. And so they looked to see what happened to the actuarials as it approached Passover. And the three leading causes of death dip in the 2 weeks before and 2 weeks after Passover. They don't die. And this is non-trivial. Think what's going on inside these people. They're actuarially scheduled to die. Your time is up, buddy. Adios. But something is saying inside, no. It's another intention, and it's a clear, unambivalent intention to live, to see the family, to get through the holiday. You all know this is true, right? And this was statistically significant in every single place they looked. In other words, the idea pushed the pause button on death itself. It forestalled whatever the final illness was. That's important. That's the door swinging the other way. But it'd be nice to get something a little more cheery, something that gets us to health without just forestalling death, right? Another month is good. It's especially good if it's your last month and you can get another. But what we really want to know is, can ideas get deep down into us and create health? And here's where I might know a little bit more than most docs, because for over 30 years, I've been doing pre-surgical hypnosis. And it'd probably be useful for you guys to know that I didn't believe it would work one iota when I first did it. But I'm an ER doc, so I'll wing almost anything. I'll give it a try. You want to try that? Let's do that, okay? Let's see how well it works. If it doesn't work, we'll do something else. That's how people in my herd think. Jan was my first patient. It's a really great case, because she was going to have a total colectomy. She had horrible ulcerative colitis. I had just cured a guy who to this day remains cured, who when he came to see me was on super high dose steroids and other medicines. And I felt like, wow, I could cure you. You can keep your colon. So we had that talk. She goes, maybe you're not hearing me. I'm sick of this colon. This colon's coming out on Thursday. I can wear a bag and play golf. I remember her saying that, And so I reckoned with it, right? Okay. Dry field, Surgeons call the area they operate in a field, a dry field, no blood. Keep your own blood in your vessels, right? Delightfully surprising comfort, really rapid wound healing. And said very quickly as a metaphor for this, really rapid wound healing. Did you heal quick? So, it seemed like a good plan, so we went for it. Dry field, keep your own blood. Delightfully surprising comfort, on waking and sustained. Really rapid wound healing. No idea if that's going to work or not. First case, get a phone call. Day after surgery. Dr. Steve, we have a problem. I broke out in a sweat immediately. I thought, oh my God, this is something bad. I said, what's wrong, Dan? She goes, well, this thing's working too well. What do you mean? She goes, well, the phlebotomists have been in here 12 times already today. Nobody can get any blood out of me. True. So I'm thinking all these suture lines inside, I don't want to say, reverse the whole thing, and she springs a leak, and then, so I go, you know what? Even a dry field can have a generous well on the outside. Give them the blood they need, right? Oh, there's a side note in there that the hypnosis, the trance ended, but the hypnosis doesn't end. We're not going to have time today to get into what hypnosis is. I'll just tell you, it's not trance, and that case alone would prove it. Next phlebotomist comes in, boom. But the other thing about Jan was, and all the people that I've seen subsequently with one exception, but scores and scores of people that I treat pre-surgically, is that their wounds heal so fast. I've become accustomed to saying, if your doc says go in at 14 days, you be there on day 12. If they say come in at 5 days, you be there on day 4. Why? You're going to heal so fast, those stitches are going to have to be dug out and less. And that's almost invariable. I mean, I see that all the time, and think what that means. It's just an idea. Really rapid wound healing. It's just an idea. But here the idea is swinging the door the other way toward health. Someone gets out of surgery, they're not healthy. Their organs have been rearranged. Things are different, right? But a few simple notions delivered with some technique, but maybe not even great technique. And still you get these extraordinary results. Why? Because ideas actually can feature in the causal sequences that lead to health or illness. That's where we're going with this. Are you with me? Okay. You all kind of know this, or at least most of you. People who are raised in Western society, broadly speaking, have this experience. Look, there's some good things about childhood. I don't remember them, but there are, no. But it's a time of, helplessness and dependency, but really limited choices, right? And so you've got to go to school. But there's a test, there's an oral exam, the teacher's got a wild hair, there's a bully. There's some potentially humiliating event up ahead, right? And you really don't want to go. And we all know this, we just don't think about the other side. And the other side is the most important part. So you wake up and lo and behold, you have this kind of peculiar relief. Oh, I'm so happy, I got a sore throat and a fever. Mom. So you don't have to go to school, right? You had a wish. The wish got fulfilled. It's retreat into illness. But worse, think about this now, because we understand conditioning, right? Someone does something, you give them a reward, they're more apt to repeat it. It's simple conditioning. It's Pavlov, 1921. And you got your reward by not having to go to school. Retreat into illness is a well-reinforced, unconscious strategy in Western culture. And before we're done with today, all of us need to understand it ain't okay. That's a strategy for childhood. You have more options as an adult. Only healthy solutions. Only healthy solutions. Right? But as I said, that just proves the one part of it that ideas probably have an influence. Or at least, it doesn't prove it, but it gets us a little further along the argument. But what happened after the moment passed, right? Test was over, somebody else gave the oral report, the bully punched someone else in the nose, got it out of his system. You got well. You wanted to get back to school. You let the wish to retreat into illness go. You had a wish to get well. You got well. If you didn't get well, that's a whole other story that we can think about later, childhood illnesses. But broadly speaking, who hasn't had that experience? No surprise, right? So let's take stock of where we are. We started with a fibrillating heart. Nothing around it except electricity. And a doc saying, well, we can fix that, we'll zap the heck out of it, and you'll walk the world with a scarred heart, but a normal sinus rhythm for the rest of your days. And that's a good thing. We don't want to take that away. We don't want to eliminate that. It's a good option. But it left out so much. Now we've looked at how ideas can cause illness. And please understand, I'm not saying they always do, because they don't always do, right? An Anopheles mosquito, randomly flits over toward Michael, and and if he were to get malaria, which he won't, we're not going to blame his unconscious wish for malaria. But what we are seeing is that it can contribute, just as ideas can contribute toward health. Now let's think for a second about placebo, because it ends up being important. If we can understand what placebo actually is, instead of just saying placebo means a bogus cure, if we can understand what it is and what drives it, then we're really going to enhance our personal agency in several ways, which will ultimately matter, if not to you, then to someone you're taking care of. So it's worth exploring. We have to drop our preconceptions about what placebo is and go all the way back to ancient Greece and ponder this for a few minutes. The Asclepians were the healers. This is 4th century BC. They were the healers. There's healers in the Amazon. There's healers in Hellenic Greece. And they had these magnificent temples, and you had to work to get there. You couldn't just walk in. You had to do stuff to get there. It was a journey. And they were smart people. They were into marketing. And so they had these billboards outside their temples, stelas, these big rocks upon which they would carve the results of their best cases, just like Mark and I plan to do someday on Little Orphan Alley. And one of the major rocks says exactly this. A bald man walked in, received the incubation. During his sleep, the god entered his dream and anointed his head. And he left with hair. And I find that so cute and quaint, dear. That's such a good story, and I'm sure it drew bald people in. It's good advertising, right? Quaint little thing. I'm being a smart aleck now. Anyway, I thought that until the minoxidil thing came around. And I want to tell you about that. Think about this. Think really hard about this. Hair growth seems so trivial to you bushy-headed people. It's not trivial. If someone's bald, let's say, and you're going to get their hair to grow back, you got to get into the cell And you've got to reactivate all the intracellular machinery, transcription, translation, protein production, extrusion of alpha keratin. It's a complex thing. You know, it's no small matter. This is big from the purely physical point of view. One day in the emergency room, this guy comes in with a cough. I lift up his shirt with his permission because I want to auscultate his breath sounds. And I was a bit horrified, and I'm embarrassed by that. But I was a little bit horrified because I'd never seen that much hair on a person's back in my life. I couldn't see skin anywhere on there. I thought, wow. I thought a lot of things, but anyway, it was even crunchy listening on it. And so I had to, hey, what's going on with your back, man? He goes, well, I'll tell you. Didn't used to be that way. I thought, oh, it's going to be a glandular thing or something. He goes, no, it's not a glandular thing. I'm on a medicine. It's called minoxidil for blood pressure. It's a side effect. My wife doesn't mind it. I go, really? I don't believe that. Upjohn was in big trouble because it wasn't just guys with wonderful saint-like wives. It was people broadly. I mean, there were men and women on this drug. And this was a really distressing side effect, hirsutism from minoxidil, and lawsuits were pouring in. And some guy in the lab says, hey, I got an idea. Let's make an ointment out of this thing, a salve. And let's do a really, really good study, a randomized, double-blind, placebo-controlled study with proper statistical analyses at the end of it. And it's got to be good because, A, we're facing billions of dollars of lawsuits, and this is a multi-billion-dollar market if it works, so let's make it right. So they did. The bald guys had a little circle. The women would count, not knowing if they were getting placebo or if they were getting the drug. The number of new hairs formed, they'd report it out. Statisticians would deal with it. Here's the good news. The study people grew hair. Something like 55, 57% grew hair. That was the vehicle, which was a salve thing, plus minoxidil. Looks good. Now, if it can beat placebo, we're out of trouble. What was interesting, think for a moment, placebo was the vehicle. That's what we call it when we're doing science. If we were medieval barbers, we'd call it snake oil, right? And if we were Asclepians, we'd call it an anointment. 31% grew hair. 35.7 in the second study grew hair. What? You're smearing ointment on your head, which has no active ingredient whatsoever. It has an idea behind it, a suggestion, right? That goes into your intracellular machinery and cranks up all those things I mentioned and starts shooting out hairs on the top of your head. Boom, right? With placebo. I always think, you know, they were smart. The Upjohn guys were really smart. It was Rogaine is the minoxidil formula. But they should have taken the vehicle, I think, called it, trademarked it Escalapia, and said, proven in randomized placebo-controlled trials to work on 1 out of 3 men. Right. No side effects, or almost no side effects. They didn't, but they've done well ever since. It's interesting, right? An idea is having a physical effect in a complex physical thing. But here's something more interesting in a different way. But it'll ring true now that you've heard the other stories. In 1983, in the World Journal of Surgery, you can look this up, patients with gastric cancer were being treated with one of 3 different treatments. 2 were chemotherapy, and 1 was placebo. Everyone was told that we don't know what you're getting, but you could lose your hair. And sure enough, the people in the first group and the second group getting the chemo did lose their hair. But now you already know, right? You can guess it. 30.8%. of people getting placebo also lost their hair. And all there was an idea. The idea. Now we have to think, because this is really important, like the kernel to everything resides in this little secret. What is happening? What makes this work? How can placebo make you well? What drives that idea? How can placebo make you sick? What's driving? How can it make hair grow and make hair fall out? If you look at the literature, there's Harvard is working on, all these people are working on it, but you can know it if you do hypnosis. Everyone says it's belief. Belief in what? Belief that it's going to work. Really? In a randomized trial, belief that it's going to work means that the people who are having, if you believe the belief theory, who are having the reaction are the ones who believe the most. And the ones who aren't believe less. But there's no evidence whatsoever to suggest that's anywhere close to true. Moreover, everyone in a randomized trial knows they only have a 50% chance of getting the real thing. And if they get the drug, it's a trial. There's no proof that the drug even works yet. So everyone has doubt in a randomized trial. So it's not belief. If it were belief, every schizophrenic would be stricken with every delusion he's got, as would the hypochondriacs. If it were belief and belief only, every absolute devout religious believer who had no doubt whatsoever in the potential for a religious cure would be cured. It ain't belief. That's not enough. That's not what drives it. And because we have a short time, I have to just get at what it is. It comes out of something very primordial in all of us that's hardwired into us. I call it authority, but here's what it is. It's a pattern. When you're born, you're totally helpless and totally dependent. And you have to quickly scan, identify, attach, absorb, learn, and survive. You have to do that, or it's over for this species. We're all hardwired in times of helplessness and dependency to scan and find who? The one least uncertain. I can't go in for time restrictions into why it's not the one most certain, but it's the one least uncertain. That's what we scan for as a herd. And I call that one, the authority. And those ideas, just like the religious ideas you learned, or the political ideas you learned, or the right and wrong ideas you learned, or the reality ideas you learned, or whatever, that get absorbed way, way before critical faculties are developed. At a level so deep, it's hard to extirpate them if you want to. Those ideas go in and sit and become operative and work. The idea of the authority. I don't mean an authority like a boss or a policeman. This, for lawyers here, this is a defined term, authority, right? I mean that in a situation, circumstance of helplessness and dependency, the one least uncertain dictates reality. My reality equals your reality. That's part, a small part, of how some hypnosis, not the kind I do, but the old authoritarian hypnosis, that's why it worked. Authority drives the placebo response. It drives the idea in before it can be judged good or bad, right or wrong, healthy or unhealthy. The one least uncertain, right? In Greece, the Aesculapian priest was the one least uncertain. He drove the idea in, and it wasn't a quaint little superstition. It probably happened. I mean, the minoxidil vehicle happened, for heaven's sakes, right? In the minoxidil trial, the doctor with the white coat and the stethoscope around his neck was the authority. All he gave was snake oil to those people, and he didn't even know it was snake oil, right? World Journal of Surgery, the same. And now we have 7 decades of studies, 7 decades of randomized controlled trials, tens of thousands of patients, all of whom have responded positive, negative, or both to placebo suggestions, to authority, right? So again, we got a really important lesson here. Mind matters, it matters big. There's a lesson there. I wanted to save that because, look, in the hospital, we often say, oh yeah, that's a cantankerous old coot, or that guy, he's really testy, or that guy. But we all know, doctors all know, they're the ones who make it. And we all say, oh yeah, he's gonna make it, she's gonna make it. The importance of understanding this is because if you don't allow yourself to feel that you're utterly without agency, that you're helpless and dependent, which you're not. If you're not willing to relinquish to him authority in the sense I'm using it, you protect yourself. That's why the cantankerous ones make it, because they don't listen to all the crap that gets thrown out, all the negative suggestions that come out. Be cantankerous. Challenge authority. Understand that the doctor you're talking to, he doesn't know who you are. He doesn't know his own future. He can't predict your future. He cannot do it. All he can do is assuage his own personal sense of uncertainty by pretending he can. He can give you his best guess, an educated guess. He can tell you studies. That's all legitimate. You want that, right? But if you say, what are my chances? There's only one answer to what are my chances. I don't know. I don't know. Miracles happen every day. In a study of 100 people, this happened. If you match them, there are odds there. We'll only know your odds afterwards, right? That's important. So when I'm saying it as a catchphrase, be cantankerous, but what I mean is, you're not helpless and dependent. You get to choose your doc. If you don't like that guy who says it's ablation time on the first visit, you can say, you know what? You got a lot of learning to do, buddy. I'll write you a letter. I'm too angry to talk now. And walk out the room. You don't have to. If somebody gives you a negative suggestion, I'm very, very sensitized to this because I give suggestions all the time in hypnosis, right? It's what I do. Some guy who has some semblance of authority gives a negative suggestion. I know from everything I just told you, from 7 decades of placebo-controlled trial, I know that's dangerous. And so I fend against it, and you should too, and you should for the ones you advocate for. Right? Lesson 2. Are you guys with me? You're applauding with your heart? Yeah. Okay.
I'm applauding my hands too, but I mean, that's so cool.
Right. It is powerful. You should see what it does. I'm going to fly through the next couple slides, okay? Very quickly. I like to talk about warts because I think it's a funny word. Wart. But look, this is pretty simple. This is what people think. This is what our science teaches. You get a virus, HPV, it goes into young skin cell, it pyratically takes over the cell, and boom, a wart comes. And now, of course, we know it's not just a benign skin lesion. HPV can cause cancer, too. So think what I'm about to tell you. Think what I'm about to tell you. If mentation has any effect on this viral-caused tumor, it could conceivably have an effect on cancer as well. It's the same wart, just different subspecies, right? So this becomes important stuff. But look, our sequence, there's a book called The Book of Why, if you're interested in causality. That's the book to read, Judea Pearl, UCLA. Big artificial intelligence guy. But that causal diagram is pretty simple, right? You get a wart, you get a cell, you get a virus, you get a cell, you get a lesion. But remember, we're trying to introduce mentation ideas into this sequencing, because we know it's right. Don't you? Don't you just know it has a place? But you can't find it in a petri dish, so of course the scientists don't know it. They don't even say they do. It's docs who over-extrapolate. I think it's really curious to note that the Merck manual in the 1990s had hexing as a cure for warts. Yeah, hexing. If I had more time, I'd tell you a couple of hexing stories that we did in the ER that, as I think back, probably were ill-advised, but they worked. And then there's a whole 40 years of hypnosis literature that shows hypnosis, which is ideas evoking responses, also cures warts. And it also cures some cancer tumors as well. My wife hates this story. But this is really important because that Wart diagram is the diagram of every illness, basically. It's some kind of physical thing leading to another physical thing to another physical thing to boom. Signs and symptoms, right? And that is the fallacy of blunt beginnings. It can't be right. Right? It's not right. And I liken it to this, I'll tell it quickly, the airplane story. So here's a guy, he's down and out, he's sitting in a private airfield, right? Just feeling terrible. His finances are done, his wife's leaving him, his plane's been repossessed, and it couldn't be worse, except he just got a diagnosis of some kind of venereal disease for a one-nighter that he did, right? He's as down in the dumps as you can get. He's sitting there. Some wealthy guy fires up his single-engine Cessna about 30 feet away. The guy can't take it anymore. And so he stands up and he walks into the propeller, right? It's over. You go on the death certificate, and the death certificate says cause of death. Blunt trauma to the head. Because the blunt trauma explains all the physical things that the pathologist could see. The fallacy of blunt beginnings. And here's the important concept here, and it's really, really critical. It's fundamental, in fact. When you're looking at cells, molecules, you're doing bench science. At low levels of organization, there are no emergent, or very few emergent properties, what we think of as emergent properties. But as the level of complexity of anything increases, new properties emerge. So motion, replication, ideation, imagination, creative problem solving. These are all emergent properties that we all possess. And this is an important lesson. You all have that. The Petri dish doesn't have that, but you have that. Motion took him there. His sad, sorrowful ideas about no future, or perhaps a wrong identification with a father who committed suicide. We don't know. But we know that mentation had something to do with the story. It's not a simple blunt beginning any more than the blunt beginning of a wart. You with me on that one? Emergent properties, it's principle. So this is my last story, and then I'm going to give you my advice on how to do things here. I'm going to stick with warts for the same reason I had before. Some of you will know this guy. He's not at Scripps anymore, and I'm going to call him Gene. He's a gynecologic surgeon. And I would say on a scale from 1, adore the guy, to 10, abominable, Gene was roughly 11 in that range. He was not a nice man. And so his wife had called me and set up an appointment. And he blasted through the door in my office and said, and forgive my language here, he said, "This is bullshit." And I go, "Yeah, I think I'm feeling the same way." He goes, "Yeah, my wife wants me here, but I'll be damned if this is going to work." I said, "Well, you're not the one damned. I'm the one damned. because I'm going to have to sit here and try, and you're hell-bent on failing. He didn't like that. He didn't like that. So I kind of had my first hook in him. What's the problem? Well, Gene's a surgeon, and he had warts for hands. He had thousands of warts on his hands. And he was double and triple gloving, and they were fixing to kick him off staff at Scripps. True story. I don't know why they hadn't put him on, some kind of leave already. But he was in serious trouble in terms of his livelihood. So his wife had called. Now I knew, because he was a notorious cheapskate. So I said, Gene, this is doubly bad for me. Why so? I'm the one who's wasting my, no, I'm wasting my time. Your wife set up these appointments already. Just from your attitude, I can tell you're going to no-show. I need you to pay in advance. He's the only patient I ever had pay in advance. Because that guy would do anything to not lose a nickel. Gene got cured of his warts. It wasn't all that simple. My usual technique is to empower a mantra with authority. Now you get that. And then by borrowing my authority, to have them repeat that mantra, not 9, not 11, but 10 times whenever you think of warts, and they'll go away. And they do, because authority drives ideas to a very deep and active level, right? But that wasn't going to work with Gene, because Gene had other things going. Gene wanted out of operating. He was done as a surgeon. He wanted to collect his disability. He had 20 grand a month or 14 grand a month, I think it was, that would come to him. And he wanted to live the good life afterwards. So therapy involved a lot of things. He had some really baleful wishes, right? And in a way, his unconscious had dealt him a fairly reasonable hand, because he didn't have some horribly disabling thing. It was just gross and deforming, really. But in talking with him, I realized that was in real collision course with his self-image of being an upright, high-integrity person. And so in 4 sessions, we worked those through. We didn't work them through. I worked him through as he sat there resentfully in a deep hypnotic trance, right? And ultimately, it went away. The key thing there being that it's not the physical causal chain that any of us have been told. He had them for a reason, and they went away for a reason. You get that? He had had HPV virus on his skin for God knows how long. It could have gone to his elbows, could have gone to his neck, could have gone on his butt, could have gone anywhere. It went on his hands. It's for a reason. If I have somebody who comes into the office and says, I have a headache, and I've had everyone in the world treat me and nobody can fix it. I say, well, show me where the headache is. Well, it's right around here, said the Jewish patient. It's like a yarmulke. You don't need to know. That's it. Right? That's not an organic, quote unquote, following a neural path. There's a reason for that. Turned out it was a guilt, right? Which takes the form unconsciously of a wish for punishment, not in everyone, but in people who have incorporated that guilt notion. Oh, this isn't that. That's scary. I'm going to skip that. I just put that up there because Mark's going to be quizzed on that one tomorrow morning. Let me show it to you here. This is how it works. And if you have this causal sequencing in my, oh, you guys can't see it. I'll do it up here. If you have this in mind, the importance of causal modeling is it has to give you an explanation. It has to, of course, incorporate what we already know. We're not going to throw out the baby, right? We're keeping it. It's brilliant. It has to be predictive, and it has to, in my view, it has to lend itself to experimentation so that we can get farther along in our studies. I won't have time to give you the ideas for experiments, but here's how it works. There are multiple causes to almost every illness. Some illnesses are all physical, some are all mental, many, perhaps most, are a combo. Okay, psychological, internal, hormonal, electrolytes, whatever, external, infection, toxins, exposures, various things like that. There are a host of causes, not just one. These causes confront what I call host defenses. And host defenses, this is what you need to know for us to get to the how do we defend ourselves part. Host defenses aren't just what we know of your immune system, which maybe is a tenth of what we're going to know compared to 200 years from now, right? Brenda, I told you I'd call on you. You too. Host defenses include your psychological defenses, defense mechanisms, and things you put in your head to defend yourself, like what I've said 3 times and now I'll say 4. Only healthy solutions. It's not okay to retreat into illness. It ain't childhood no more, right? Only healthy solutions. And then what happens is, as these ideas and physical and psychological causes pound and pound at your host defenses, eventually some will get through. Not always, but if you're sick, that's what happened. And they'll funnel down according to a principle of parsimony. Inside of you, there's a principle that says, if I have 5 causes coming at me, and they're all saying, do this, do that, do this, do that, and illness is going to be the answer, I'm going to pick one illness. Economy. Okay? And then that one illness, which would be a HPV infection, spreads out. It could be a million things. It could be encephalopathy. It could be warts all over your body. It could be sepsis. It could be simple hand warts. It could be a single wart, right? And what determines from that array what you actually get, again, most importantly, is your host defenses, your immunities, your resolves, your coping mechanisms, right? And ultimately manifests as signs and symptoms. What this does, think about this. If you think of health and healing this way, multiple causes, refracted through these principles and host defenses, and then splayed out as signs and symptoms, it changes the way you have to address a patient if you're a caregiver. Let's do that part first. Caregivers now have to ask about causes. Why today is an important one. In addition to what's your potassium, right? They have to explore your overall host defenses. Now, some of that's done really well by people like Mark. They go, well, what's your stress level? How's your sleep? What's your exercise? That's all host defenses, okay? But if you have persisting mental causes that are unaddressed, problems happen, okay? So it's not just your defenses. You've got to get at those persisting causes, right? And then doctors have to understand the power of their authority. You might not wear a white coat. You might be the friendliest guy on earth. You might put your arm around everyone, touch every patient, it doesn't matter. You have tremendous authority. You should know that, number one, and then you have to watch how you craft your messages so that they're positive, salutary, health-giving, right? That's how this would affect doctors. And then in terms of treatment, of course, you're going to continue traditional therapy, but all these zone 1 causes now have to be addressed. If we had time, I'd tell you about the last time I talked here, it was about guilt-engendered illness. Some of you remember. And I had one man come up to me and say, you can, and he was almost dead. You can help me. Something you said in that talk. He had been through cancer treatment. He had a bone marrow graft. He had graft versus host and then cytomegalovirus infection. He went from 189 pounds to 89 pounds when he knocked on my door. But when his zone 1 causes, his dangerous identification, his unhealthy wishes, his guilt, when those things were addressed, day 1, he started gaining weight. He's alive today. I don't know how long ago that was. You know, the MS guy, right? And we have to strengthen host defenses, which means everything you hear recommended is still important, right? Water, air, exercise, sleep, naps. Naps are important. But you also have to be very careful. I want to warn you about this. Your defenses are already fairly fine-tuned. You are a delicate balance, an evolutionary piece of near perfection, right? You really are. Most things can take care of themselves. We need to think that way as doctors. You can't just willy-nilly give stuff. Again, I don't have time to go into detail, but I will tell you this. There's people all over this county giving folate to people, right? Here, take your B vitamin, take this, take that, take that. Do you know that tumor cells overexpress folate receptors? Yeah, they do. And so if you up your folate and you have some small rest of something in your body, it's going to grab that before your healthy cells do. And there's a million more things like that, so be careful. Make sure that whoever's giving, I'm going to tell you one other thing too. Do you know that 9 out of 10 naturopathic solutions that were studied for this were found, 9 out of 10, were found to have thyroid hormone in them, even though it wasn't listed on any of them? Be careful. When you're addressing your host defenses, do it mindfully, respectfully, reverentially. I don't have time to tell her story or Michael's story, which I just told. Let me leave you with this, and because I'd like to have enough time for questions. All of us need to embed a new operating principle in our thoughts, if you haven't done it already. Because we all got reinforced retreat into illness when we were young. You tell yourself deep down, insistently, unambivalently, only healthy solutions, only healthy cells. And you can borrow the volition of someone with authority by seeing your doctor or your hypnotist or your naturopath or your chiropractor and having him or her work with you on that. That's important. Curses that came in from other authorities, if I had more time, I'd go into how to, but you need to expunge those. Step 1, recognize them. He said, I only have. No, he doesn't know that, okay? Find those curses, unearth them, expose them to the winds of doubt and logic, and get rid of them. That's key. You can't have limiting ideas inside. And then these zone 1 causes, remember, be careful what you wish. The most dangerous noetic causes, mental causes that I'm aware of, are dangerous. We're all identified with somebody. That's what we do. We imprint on our dad or our mom. You need to see when that imprinting is driving you over the edge and veer away, right? I had a guy who got swindled in finances. I'm treating him right now, but he's basically fixed. He got swindled. He fell into a gigantic depression. I kind of kicked myself. It took me 3 times to find that what happened to his father was, same age, he got swindled, fell into depression, never came out of it. Okay, good. Let's come out of it. You're not your dad. He gave you a good path, but that was for childhood, okay? Now you pick your own path. Dangerous identifications. Guilt is a whole other talk. I think you have a sense of it. You don't need to punish yourself to learn from a mistake. right? And then the retreating into illness, again, don't let yourself do that ever. Find a healthy way out. Why? Because ideas matter. Mind matters. It's in the equation for all of us. It's our emergent property, and the beauty of it is, final slide, is you get to use it. When you're looking for a caregiver, Mark and I talk about this a lot. There's a lot of compassionate people out there, but compassionate people, if they're not knowledgeable and wise, screw up a lot. I know that because I did that for 3 straight years as a family practice resident. And in embarrassing ways, I have to say. Compassion is not enough. Of course they need the requisite knowledge, but they have to have the humility to say, I don't know. I don't know what your future is. I do know this, and I know I'll be there with you, and together let's see how well you do, right? That's the person you need. When you have an inkling it's wrong, trust your inkling and get out of there. You don't have to be there. You have agency, right? And then you need this, what I call this reverence for the delicate balance that you are. Respect it. Don't tamper with it unless you absolutely know it will help you. That's the key. And then as Mark said at the beginning, and what I'll conclude with at the end, everything we just talked about points to the power. It's almost like it's a sub-layer in the cortex. The power of intention. When that lights up, things happen in the body, right? Everything we've talked about goes to intention, to wishes, to how they compel events. And so when you're picking a caregiver, when you're being a caregiver, you have to have curative intent. You have to be in there. Don't be afraid to be surprised by a bad outcome. I would rather be surprised by a bad outcome that I did everything I could to prevent than to gloat proudly and say, it's just what I said would happen. Curative intent. Use your agency, right? Stay well. Simple.
Thank you, excellent. I understood quite a bit, but I was asked to read a book called Biology. And after I completed the book, I knew that I didn't have enough will to do what this man told us
That's good.
to do. Am I to understand you think authority and hypnosis suggestion is better than biology?
Okay, so thank you very much. I'm going to repeat it just in case. So Biology of Belief is a book that's very popular, and it does, in essence, what I said it often will try to reduce belief to sort of quasi-scientific molecules and systems, okay? But her question goes more to the mentation side of it. It's like, I realized I didn't have enough willpower of my own. Are you saying that there's something in hypnosis or in other authority that will get me there? Is that correct?
I want to know if you think suggestion and authority and ideas matter. You gave me the impression you thought belief was overrated.
Yeah, so do I think belief is overrated? Clearly I do, okay? I tell you with absolute certainty, there is an element of belief in authority. I believe he's the one least uncertain. And that's where it stops, okay? Placebo is driven, and hypnotic responses are driven by authority. Trance is simply a way of enhancing authority. If I walk you into a trance and you've never been there before and we're sitting there in trance land together, there's only one way out, I suddenly have a heck of a lot more authority than I did when we started the trip. So yeah, I understand that authority is the driver. Authority not in any common sense, but in the way I'm saying, hardwired, neurologic, evolutionary, helpless, triggered by helplessness and dependency. Ideas go straight in, right? So I don't have more time to go into that, but I think, yes, belief is overrated, and authority is way, way, way underrated. You may not know it, but doctors are being taught not to use any of their authority. There's all kinds of fancy terms now for how to not be authoritarian. But if you have it anyway, which as a physician, chiropractor, naturopath, caregiver of any kind, if you have it anyway, which you do, that's my strong argument, you use that to help your patients, not harm them, right? They believe you're the one least uncertain. That's where belief ends, in my view. But let me add one thing. You can borrow, if you feel you don't have enough personal willpower, and none of us do in certain circumstances, you find the one who aligns with your intention and borrow theirs. Whether it's a friend or a family member, who could also be a friend, I suppose, and or a hypnotist or whatever. And that's what we do. That's why there are healers. That's why there have been healers since the beginning of time. We're borrowing their intention to augment our own. That's what's going on there. Yes? Sorry.
Experience is, oh, I'm sorry, is, I don't know your voice, is years ago in San Diego, we had documentation.
Sure. Yeah.
Stage, and I think there's a goal watch and or something.
Yeah.
What, can you tell me what it actually looks like? If you hypnotize me in a session, am I asleep? What does it look like?
Yeah. So the question is, what does hypnosis look like? What is hypnosis? It's a big topic, okay? I will tell you a couple things quickly on it. First of all, it's been incorrectly understood for 300 years. The notion of trance and hypnosis are conflated, and trance is an effect and hypnosis is the cause, okay? So when you ask a question like that, I assume you're really asking, what does trance look like, or hypnotic trance look like, right?
Well, when I make an appointment,
You're in for a cure, period. And it doesn't matter what it looks like to get there. Your unconscious will decide what it looks like to get there. You're in for taking my curative intent internally and actuating whatever mechanisms inside you exist to affect the cure. And I'll use whatever experience I have to figure out what the keys are to unlock those doors. If you ask me what trance or hypnosis looks like in the office, my operational definition, this won't satisfy you, but this is what I see all day long. An absence of non-prescribed behaviors. It's as simple as that. That's all. An absence of non-prescribed behaviors. So I'll prescribe certain things, and then within that, your individuality will choose how to react, what to take, what to not take, how to get better. Okay? Probably all I have time for, but
Okay. Hi, Steve. Thanks very much. I'm a physician as well, and I embrace what you're saying, and I've shared it with patients as well. One of the things I found that many patients resist is the idea that physicians are an authority figure. They say, well, they're a professor. They have all these initials after the name. How can I counter them? And the answer is you really have to be proactive and stand up for your own internal messaging, which is more often than not true. The other thing I would just like to share, it's a bit of a joke, but they say that the average physician is average. That means that half of the doctors out there graduated in the lower half of their medical school classes. Statistically, that is correct. The other thing, there was a dean at Harvard many years ago who told the entering class they're going to teach the class everything they know about medicine over the next 4 years, but there are two problems. Problem number one, half what we teach you will be proven wrong over the years to come, but that's not the big problem. The big problem is we don't know which half is wrong. So question, don't hesitate to question, be proactive. I just want to amplify what you're saying.
No,
And there's a phrase to
absolutely.
it when the doctor says something that ends up harming you. It's called medical hexing. There really is such an entity.
Yeah. Yeah. Very good.
Do you have time for one more question?
I'll take one more
So,
from her over there.
oh,
No,
I did have a question though. You're talking about why today when someone presents an illness, but what would you suggest to do before you even get to that question of why today, or before you actually manifest that illness? What's the step that you could take? Is it a mantra or?
to the patient, what would I suggest the patient do? Everything I just wrote on those last slides. So let's go over that again. Okay, watch what you wish. Be very deeply inspecting for dangerous identifications. You're identified with your mom, maybe that's taking you in the wrong place. For baleful wishes, I wish I could get out of here no matter what. For guilt, I did this, I need to be punished, that's what my priest said. These kinds of dangerous ideas. Fortify your host defenses, understanding that host defenses are physical and psychological. Only healthy solutions. Retreating into illness is no longer valid. You know, that type of thing is critically important.
And worry can go into that too, right? You worry yourself into sickness.
Well, let me take this one because that's a good. Do I have time to do this or no?
Yes.
Okay. So, no, but close. So the question is about worry. So I'm going to tell you two things. You know, there are people who never worry. It's hard to know that if you're brought up in a sort of traditional Jewish household with grandma and ma, and they're always worried about everything. It's hard to know that the world has places where people don't worry. Classic Chinese expression, we should all embrace it. Worry is a misuse of the imagination, implying there's a proper use, which there is. But what I've tried to teach you today is that until these ideas crystallize into intention, they can wear down your host defenses by keeping you awake, you have less sleep, your resistance is down, and so forth. So they'll compromise host defenses. But until it crystallizes into a baleful wish, it's not going to be one of those insistent noetic causes for illness. That said, worrying is a habit. You learned it. I'm not saying you did, but I did. And so you can unlearn it. And you start, the first time is hard, the second time is easier, the third time. But eventually you cultivate the habit of use your imagination properly in those circumstances. Anytime you worry, say, now how could I use this sick imagination of mine in a proper way? And you'll begin to create the habit. I guarantee you within 3 years, you won't even know what worrying is.
From a caregiver standpoint, if you have somebody who's worrying every minute about something, change that to something else to think positive about. Because that's, my mother worried herself to that, you know, because she was worried about every little thing, so.
Yeah,
Got it.
you got to break the habit. Just understand it's a habit, and it's not hard to break if you're intending to. It's all about intention, intending to break it. Good?
Good. I just have three things to say. There's feedback forms or questionnaires about what we should do in the future, what you want, and we will listen to you. The next talk is November 12th. It's by a woman named Trish Torrey, who's Ashley's mom, on how to stay safe in the hospital. And don't go in the hospital. That's the first answer. And just thank you for coming, and appreciate it all.
Was that good?